My name is Melissa Luck, and I am a community health worker.
Well, I just want to say how glad I am that I'm in this program and that you are an existing program.
Hi, my name is Joanne Glass, and I'm a community health worker.
Hello, my name is Vicki Martinez, and I'm a community health worker.
I just get excited because I want to impress you that I'm right on the mark as far as what I need to be doing to keep my diabetes under control.
Hi, my name is Diana Brown, and I'm a community health worker.
My name is Lisa Reed.
Hello, my name is Marguerite Dawson.
My name is Beverly Anderson.
I'm Barbara Mack, and I am a community health worker.
We are community health workers.
I'm Robert Mayberry, Principal Investigator of the iADAPT project.
Make sure that I'm really aware of taking my medication.
My name is Toy Dixon, and this is the iADAPT project. Now the Principal Investigator, Dr. Robert Mayberry, will discuss in further detail the iADAPT project.
Hello, I'm Robert Mayberry, Principal Investigator of the iADAPT project. iADAPT is funded by the Federal Agency for Healthcare Research and Quality as part of its program on innovation, adaptation, and dissemination of comparative effectiveness research products. iADAPT is an important collaboration between Morehouse School of Medicine and the West End Medical Center. The specific objectives of iADAPT is to incorporate medication adherence into patient self-care and to the West End Medical Center Diabetes Self-Management Education Program, as well as incorporate evidence-based medication use into the decision support function of the electronic health record at West End Medical Center. The iADAPT project uses community health workers. Our community health workers are professionally trained to conduct diabetes self-management education as well as motivational interviewing. Motivational interviewing is a directive, patient-centered behavioral approach to sustaining behavior change over long term. And in fact, we're excited about this innovation as we believe this is the key to sustaining self-care as well as adherence to evidence-based medication. The community health workers are trained to conduct in-person interviews as well as conduct interviews by phone. Again, the purpose of which is to educate patients about medication adherence issues and the use of evidence-based medication, as well as conduct motivational interviewing for behavior change. Community health workers are also trained to serve as a resource for patients at West End Medical Center. A key component of this project is effective communication. In fact, our community health workers are there to assist the patients in communicating effectively with the provider, but they are also there to assist the providers in their knowledge of the patient and communicating well with the patients as well. The key to self-care, the key to medication adherence, and the key to improve diabetes care quality is effective communication. And that is one of the areas that we believe our community health workers are uniquely trained to carry this project forward. This is what we anticipate as the success story of iADAPT. Number one, patients will improve adherence to evidence-based medication. That's the most important part. Two, we anticipate an increased attendance at diabetes self-management education program. And we anticipate the completion of diabetes self-management education program at West End, with the emphasis again being on evidence-based medication use. We also anticipate that through our community health workers, that patients are more likely to return to the clinic at regularly scheduled visits. As a result, our community health workers are in constant contact, or I should say in monthly contact, with West End Medical Center patients to remind them of their scheduled diabetes care appointments. We also believe, through community health workers and the sharing of information from the community health workers to the provider and the patient involved, of course, as the center, is that we will likewise see an improvement in the ability to advance behavior change. Again, behavior change is the key component here because we anticipate long-term behavior change related to medication adherence use, but also self-care practices in and out of the clinic. The key component here is where we are trying to achieve, which is an improvement in overall quality of diabetes care, an improvement in glycemic control, and of course, as I said before, long-term adherence to evidence-based medication, as well as self-care practices over time. We are excited about this important collaboration with the West End Medical Center.
We will now hear from Dr. Jacobs, who will share with you how the iADAPT project has been beneficial to the West End Medical Center.
Hi, I'm Dr. Teresa Jacobs, Chief Health Officer and Vice President for West End Medical Centers. We are a federally qualified health center in the greater Atlanta area. We service roughly 20,000 patients every single year, and unfortunately about 20% of those patients are actually diabetics. We are really thankful and grateful for our partnership with Morehouse and the iADAPT project. We have been able to do some phenomenal things. For example, in the last 4 or 5 years, our average A1C was greater than 10. And unfortunately, we know that that means that there are greater complications, more morbidity and mortality with those patients. The iADAPT project has allowed us over the last few years to get over 80% of our diabetics A1Cs below 9. That is just absolutely phenomenal for any project to help us do that. And what they've allowed us to do to actually input some of the processes that their CHWs or their community health workers are doing to put those in our regular workflow, and we're able to sustain it even after the project is over with. And so we're really thankful. Many families are very thankful and grateful for this project, and now we're able to sustain this program along with those community health workers. So we're really very, very appreciative of this program and very thankful for the things that it has helped us to do with our diabetic population. Decreasing morbidity and mortality in this patient population is just crucial for the well-being of our greater Atlanta community. And we look forward to doing bigger and better things with the Morehouse family. Thank you.
Now, our community health workers will explain their role in the iADAPT project.
My name is Barbara Mack, known in the community as Miss B. I am a community health worker. I have worked in the community for over 35 years.
My name is Diana Brown, and I'm a community health worker with the iADAPT project. I have worked in healthcare for over 12 years as an occupational therapist, working with individuals who have suffered from cardiovascular disease, stroke, and hypertension.
For the last 2 years, I have been working with the iADAPT project. This project focuses on medication adherence among adults with type 2 diabetes, utilizing community health workers and motivational interviewing.
Motivational interviewing is used to facilitate behavior changes in regards to diabetes self-management. It assists with facilitating change talk, and I also am given the opportunity to provide resource information pertaining to type 2 diabetes.
Some of my educational sessions include monitoring blood glucose, meal planning, recognizing and managing acute complications.
Hi, I'm Katie Mack, and I'm a registered dietitian at Morehouse School of Medicine Clinical Research Center. And we're here today with Ms. B talking about diabetes and nutrition and how to follow the diet for type 2 diabetes. Using food models here, let's make breakfast. Okay, so for breakfast, I'm going to let you hold that. And we're going to look at distributing that by having a fruit, a couple carbs, starch, carbs, a fat, milk, and that's going to be our breakfast. For our 2 starches, we're going to have Cheerios, bread. Okay, so that would be those 2. You can have a little bit of fat, 1 teaspoon there. And then for your cereal, we're going to have milk. Okay, low-fat milk preferably to go along with that cereal, and then, or fat-free milk, and then we'll have some fruit. So over here, it's important to learn what serving is of these different food groups. So on here are some typical sources of carbohydrate, your typical fruits, vegetables, protein sources such as meats and nuts and seeds, and also fat sources. So you can get familiar with what constitutes a serving, because when we go by the diet, you're going to be determining how many servings of this type of food group are in your meal, for your meal pattern. So those are the things that we have today on our table.
I also identify and assist participants with obtaining social service, such as Meals on Wheels, housing, and making appointments and prescription refills.
The iADAPT project is truly beneficial to the education of individuals with type 2 diabetes.
So let me recap. iADAPT project is about improving evidence-based medication adherence. We are doing so through a community health worker model. Our community health workers are professionally trained to conduct diabetes self-management education, but they're also professionally trained to conduct motivational interviewing. We believe that motivational interviewing will be that behavioral approach that will achieve long-term behavior change consistent with adherence to medication use, but also adherence to self-care practices. And finally, the overall intent is through the improvement in communication between the patient, the provider, with the support of the community health workers, we anticipate an overall improvement in diabetes care, leading to an overall improvement in glycemic control for the West End Medical Center. We are very excited about this project, iADAPT. It is a significant collaboration between Morehouse School of Medicine and the West End Medical Center.